City's death toll hasn't experienced a similar spike. So does that mean with 4 times as many cases, the death rate is even lower than previously thought?
Tonight, 1,496 people have died of the coronavirus in the city of Houston, 4,051 in our 19-county viewing area. Channel 2's Sophia Ojeda is live downtown posing this information to city officials. What did they have to say, Sophia?
Chris and Lauren, the short answer they told us is no. This new data coming in will not change the current death rate or how it's calculated. City of Houston health officials say that it is complicated, but it comes down to 2 very different metrics: the infection fatality rate and the case fatality rate. Here's how it works. Dr. David Pearce, Director of Emergency Medical Services for the City of Houston, says the recent Antibody study across the city that tested willing families for COVID-19 antibodies was done to look at how many people were really infected with the virus and survived. The study found 13.5% of Houstonians previously had COVID-19 by September 19th. That's approximately 250,000 people. But only 57,000 infections were identified at that time by traditional viral testing. It also showed more women than men had it, and more Hispanics and blacks had the virus and survived too. But will this new data coming in change the death rate? Dr. Pearce says no.
An infection fatality rate is when you know everybody who got infected and how many of them died. A case fatality rate is when you know of the cases that you know of and how many died, recognizing there's a whole bunch more cases you don't know of. With this, we have an idea, we have a pretty good estimate of the total number of people who are infected, and we know how many died, but an infection fatality rate is always going to be much, much, much lower than your case fatality rate, because there's generally more people that are infected than you know of.
Dr. Elaine Szymanski was also part of the prevalence study, and she says many people are still at high risk of getting COVID-19.
There's still a lot of individuals who, again, are at risk for exposure, which means that we really can't let our guard down.
Dr. Pearce says that the new data coming in will change the infection fatality rate. They are recalculating those numbers and will give us an update very soon. But again, as far as the death rate that is reported daily, and that is also known as the case fatality rate, he says that will not change. Reporting live downtown, Sophia Ojeda, KPRC, Channel 2 News.